What follows is a public comment made to Wyoming senators and representatives on behalf of Wyoming concerned citizens about the powers of the state and county health officers. We will address the following questions. Where are we at with draft legislation Public Health Orders 2? What is COVID-19? Is it concerning? Who gets hurt by health orders? What are citizens, senators and representatives, and doctors' roles? So where are we at with draft legislation Public Health Orders 2? On June 10th, the Corporation Elections and Political Subdivision Committees met. At the request of the Management Council, on the agenda was the powers of state and county health officers. Draft legislation of Public Health Order 2 was to be considered to have it prepped and ready for a special session if passed. Legislative Service Office Committee staff Ted Hewitt presented background information. Public comments were made, included by Representative Clem, who presented his alternative bill. Representative Clem's motion to make his bill constant was rejected, and draft legislation Public Health Order 2 got tabled. To our knowledge, this draft legislation has not been discussed any further since, by the Management Council or any other committee. On behalf of Wyoming concerned citizens, we are offering a public comment to, as the Management Council, the Corporation Committee, or another committee or committees surely will look at this draft legislation again soon. Mesdames, Messieurs, Chairwoman, Chairman, Senators, Representatives, thank you for all the work you do for Wyoming citizens. Thank you for letting Wyoming concerned citizens comment on this issue. We would like to start by stressing it is an emergency, that this bill be approved for introduction and voted on in an emergency session. Why? To avoid civil unrest by Wyoming citizens who are angry about the restrictions and the possibility of harsh restrictions returning this fall. Wyoming citizens are smart and practical. Social distancing has always been part of how they live. Protesting and civil unrest have not. But they are done with the health orders. The data is in. The fatality rate for COVID-19 is far lower than first expected. Why do we still have any health order at all? What is COVID-19? COVID-19 is a type of viral infectious respiratory illness like the flu is. Its official name is Severe Acute Respiratory Syndrome Coronavirus 2. COVID-19 and SARS are both caused by coronaviruses. The virus that causes SARS was identified first, and the virus that causes COVID-19 is new. The flu is caused by the influenza virus, so SARS, COVID-19 and the flu are caused by viral infections, and they all are viral infectious respiratory illnesses. Pneumonia can be caused either by a bacterial infection or a viral infection, usually a bacterial one, but the flu can become pneumonia. We have not seen SARS for a while. The other diseases form a group. The CDC calls it PIC for pneumonia, influenza, and COVID. Is COVID-19 concerning? To answer that, we need to look at all the causes of death, not just COVID-19. Here are the causes and the numbers of death for the state of Wyoming in 2015. The total number of deaths was 4,778, or an average number of 13 per day, or 92 per week. Those are numbers to be expected every year. Deaths are part of life. So far, we've had only 20 COVID-19 deaths over a whole 3.5-month period. That's a span of 15 weeks, or 105 days. So an average of 0.2 deaths per day, or 1 every 5 days, and 1.3 deaths per week, or less than 2 per week. Compared to the usual numbers, clearly COVID-19 death number is not concerning. It has created no excess deaths, no burden. This graph was last updated June 24, 2020 by the CDC, provides information on the burden of mortality potentially related to COVID-19. Excess deaths are defined as the difference between the observed numbers of deaths in specific time periods and the expected numbers of deaths in the same periods. The blue columns are the number of deaths from all causes, and the orange line is a threshold for excess death. The little red crosses outline where observed counts are above the threshold. The time period here starts on January 1st, 2017 and ends week ending June 13, 2020. And this is a graph for Wyoming. Here too, the CDC shows there has been no burden of mortality due to COVID-19. Back to our list of different causes of death. COVID-19 would be under the influenza and pneumonia category. The CDC today refers to this group of illnesses as PIC, like we mentioned earlier. Every year we experience influenza and pneumonia or PIC deaths, and 2015 was no different than others. We had 99 pneumonia and influenza deaths, which represented 2.1% of all Wyoming deaths in 2015. This was only the 10th leading cause of death in Wyoming, or 11th to be exact, if we account for the category of all other causes. What's the leading cause of death for Wyoming? Heart disease, just like for the US as a whole. Coming in second actually is all other causes, which would mean no matter what, people die every day, just like people are born every day, in Wyoming and everywhere else. People die from natural causes, they are older, or they die younger from causes we don't understand yet. Deaths due to natural causes are not concerning. The lives of those individuals are something to celebrate. In terms of disease, malignant neoplasms or cancer would be the second deadliest one. 400 people died of accident in 2015 in Wyoming. That's a lot, isn't it? What could we do about that? Where would homicide be? How about death of policemen and women, servicemen and women in action? Are they included in all other causes? Now, this is not to say that COVID-19 is not real. It is. But why are we focusing only on COVID-19? Do all other causes of death not matter anymore? Who was that? Wyoming citizens are especially concerned about the men and women who are putting themselves in harm's way to defend our freedom and way of life. What country are they going to find themselves returning to? One where people live in fear? One where the government, in panic, takes away people's freedom to provide for themselves and their family? And people let it? It is all our responsibility in the US to make sure that they return to the great country they left, where freedom and opportunities for all prevail, not fear and martial law. Of all the states, of all the people in the US, if Wyoming, its citizen and elected official, can't lead the way to come to our senses, then what? This is urgent. Who get hurt by health orders? Let's step back and say that COVID-19 is a disease we agree we'd like to focus on right now. What questions are we asking? Do we have answers? Are our hospitals overwhelmed due to COVID-19? No. Not even New York. Remember, military hospital vessels were deployed and then were no longer needed. Is the fatality rate due to COVID-19 alarming compared to other years? Nope. As shown earlier, there is no burden of mortality due to COVID-19. Not in Wyoming, not in the majority of our states. Who in our population are the most vulnerable to COVID-19? People who already have lived a long life. A life lived, we should help them celebrate. A life left to live, we should help them continue living as happily and peacefully as we can. Not scared and alone. We also need to remember that the majority of COVID-19 deaths in Wyoming and in the US are not just from older individuals, but from residents of nursing homes. Individuals who are residents of nursing homes are there because it is where they are expected to spend the rest of their journey, in the care of compassionate and skilled healthcare professionals. So putting COVID-19 patients into nursing homes would be a bad idea, for example. Wyoming citizens understand that, and not just after the fact. Instead of who gets hurt by health orders, the question should be who doesn't? For a start, by focusing solely on COVID-19 and shutting the rest of our hospital services down, cancers and other diseases have gone untreated. Isolation. Can you imagine not being able to visit your loved ones in nursing homes? Or worse, to say your goodbyes? lost jobs, closed schools. All of that causes deep sadness, stress, and anxiety, weakens immune systems, which increase the chance of developing disease, as well as increase self-destructive behaviors and violent behavior towards others. It has set some kids back in school and completely erased, for many, the historical increase lower wage earners of all races and genders had recently experienced. In short, already higher health risk and lower income individuals are the ones who got hurt most. It seems only executives at all levels who imposed and are still trying to impose those health orders on the rest of the people would be the one not getting hurt by them. Why else would they decide to keep them in place? With the CDC federal instruction dated March 24, 2020, that COVID-19 should be reported on the death certificates for all decedents where the disease caused or is assumed to have caused or contributed to death. Did we simply attribute some of the deaths we don't quite understand yet to COVID-19? Since people with heart and other diseases are at higher risk to get severely sick from COVID-19, did we or are we also attributing some of their deaths wrongly to COVID-19? Do additional payments to hospitals for their COVID-19 listed patients inflate COVID-19 numbers? Additional testing surely results in additional positive cases for COVID-19, doesn't it? How relevant are those numbers anyway? Wasn't the initial goal of our emergency orders to flatten the curve to make sure our hospital would not be overwhelmed? Our hospitals haven't been overwhelmed. Shouldn't the rest of hospitalization and fatality rate still be the numbers we need to rely on to assess whether COVID-19 is concerning? Here he is again. Increased exposure, not reduction. Increased exposure is necessary to build herd immunity. With increased exposure, we should anticipate more positive cases. With increased testing, we should also anticipate more positive cases. Number of positive cases today that cannot be compared to previous year's numbers are meaningless anyway. Consequently, logically, for all these reasons, an increased number of positive cases cannot possibly be a justification to maintain health orders. What are citizens, senators, and representatives and doctors' roles? In wanting Working Bill Public Health Order 2 to be approved for introduction and voted on in an emergency session, our goal, we concerned Wyoming citizens, is not to question medical doctors and epidemiologists' expertise and skills in finding and implementing treatment to COVID-19. It is not our goal to question our state and county health officers' expertise and skills in issuing guidelines and monitoring the situation. Our goal is to communicate to our elected senators and representatives that by concentrating only on COVID-19, we not only don't necessarily decrease the level of all illnesses and the level of all deaths, but we create miserable living conditions, worsening the health and economic conditions of the most vulnerable and putting others in harm's way in their own homes. Because of all of this, we should not, at this time, have any health order left at all. I'd like to see Working Bill Public Health Order to be approved for introduction and voted on in an emergency session so that our officials, elected officials, can do the important job they've been elected for. Everybody has a unique and important role to play. We need both the medical experts and our elected officials. Right now, elected officials need to hear and act upon the concerns of the citizens who elected them. It is urgent. The paramount objective here is to avoid civil unrest by citizens who are angry about the restrictions and the possibility of harsh restrictions returning this fall. Moving forward, increased welfare to all should drive what our leaders' decisions. Not panic, complacency, personal experiences, personal interests, or personal preferences. It is not selfish that while protecting our high-risk population, we do no harm to our low-risk population. Offering the choice and means to high-risk individuals to protect themselves should go hand in hand with giving the choice and means to low-risk individuals to go back to work and back to school. To accomplish our goal of increased welfare to all, we should cancel all enforceable health orders and offer instead guidelines. Maybe the way to get this accomplished is to adopt the following guiding principle. Not knowing in which group, the high risk or the low risk one, we, our family, and our friends will belong to tomorrow, what actions can we agree on today? Thank you for listening to the public comment just made on behalf of Wyoming concerned citizens. We are not the ones who worked on the draft legislation public health orders too. We are thankful for those who did, and we support it. Can be contacted at wicitizen@mail.com.